Picture this. Jamie is 18 years old. He's intellectually gifted, has an excellent command of language and a wicked sense of humour. He also has severe cerebral palsy that prevents him from being able to use his arms or legs to produce speech and to swallow his saliva easily. He has severe speech and physical impairments, or SSPI for short. Over the years, this has meant that his competence has often been underestimated, and as a result, he's missed out on multiple opportunities to learn and participate in school and society more broadly. Unfortunately, this is the everyday reality for people like Jamie with SSPI. Eye gaze has anecdotally been suggested as an alternative response modality for individuals who struggle to speak or point. For clinical practice, this would make educational psychology and speech and language therapy assessment measures more accessible for people with SSPI. This experiment aimed to assess the feasibility of doing exactly this. We tracked eye gaze scan paths in a visual fixation task that was based on Posner's cued attention paradigm, using two groups of participants, an experimental group of people with SSPI and a control group of participants who had no movement or speech difficulties. Participants fixated on a centrally placed hairline cross on a white screen until a blue dot appeared in the corner of one of the four quadrants of the screen. They were instructed to look at the blue dot as soon as they noticed it and to revert to looking at the hairline cross when the blue dot disappeared. Multiple controls were included in the design of the task and collection of data. These included consideration of perceptual characteristics of stimuli, involvement of SSPI individuals in the development and piloting of these stimuli, randomization of target blue dot placement, and standardization of procedure and data collection venue features. A portable remote eye tracking setup was used to ensure that the setup was accessible to all SSPI participants. Only first language English-speaking individuals with normal or corrected to normal vision and hearing and no primary learning difficulty participated in this experiment. 13 participants with SSPI and 74 control group participants were tested. Similar scan path patterns and times to first fixation to the target were seen across the two groups in the first block of test stimuli, with a p-value of 0.59 indicating no significant difference between groups. The rate of eye gaze shifts to visual targets slowed in the second half of the task for participants with SSPI, but not for the control group, as indicated by a p-value of less than 0.001 across groups and a p-value of 0.014 between the first and second blocks of experimental stimuli within the SSPI group. This plausibly reflects a cumulative effect of fatigue by participants with SSPI. Tracking of prosaccadic eye movements therefore appears to have potential to provide an appropriate alternative response modality for cognitive linguistic assessment of people with SSPI. Allowances may, however, need to be made for the effects of fatigue when using this in practice.